Hi, my name is Jen Pistol, and I'm going to give a brief overview of the primary prevention team within the COVID-19 response and go over a few resources we have put together to help pre-K to 12 schools. I'll start by going over the role of primary prevention team. Overall, our team focuses on health education and information sharing to help provide those we work with the tools and knowledge needed to prepare prior to disease occurring. This involves reducing and altering behaviors that can cause risk of infection and increasing behaviors that can have a protective effect. Our main functions are: we work with facilities, groups, and agencies to help them prepare prior to cases being identified. We review protocols and plans to help fill in any gaps and ensure the most recent and relevant guidance is included. We are a resource that can be used when questions come up about how to prepare or what guidance is out there. We also have participated in live Q&As with groups to help get information out to a large number of people. As needs are identified, we work with other teams to create guidance documents and materials, as well as putting together webinars. I want to first point people to the COVID-19 resources page for schools, colleges, and childcare programs. This page is updated with new and revised documents for schools from the health department. Within the templates and other resources section are two items I want to make sure schools are aware of. The first is a template letter that schools can use if a confirmed case is identified within their school. The second is a line list, which is a document that lists all people who have come within close contact with someone with COVID-19 while they were infectious. The contact tracing portion of this presentation will go into more detail about those. I'm next going to go over 3 documents that our team, with the help of many others, have created. All of them can be found on the COVID-19 Resources for Schools page. The first document is the How Pre-K to 12 Schools Can Prepare for COVID-19 in Their School. This document was created using information from both the Healthy Start Guide and CDC. It's meant to help schools think through what they can do to prepare before a case is identified in their school. This document goes through various sections that schools can include in their plans and protocols, such as training and educating staff on COVID-19, ways to keep COVID-19 from entering the school, communicating plans internally and with parents/caregivers, planning for absenteeism among staff and students, everyday actions that can be taken to prevent COVID-19, what to do when a case is identified at a school, overview of contact tracing, cleaning guidance, the decision to close schools, and coping with stress. The document provides question prompts followed by information to help schools think about how they can incorporate the various aspects of preparedness into plans specific to their schools. And the document ends with a terminology section. The second document is the Pre-K to 12 School COVID-19 Actions Checklist. This document provides a general list of what to expect and actions to take when a student or staff member becomes symptomatic at school or when someone with confirmed COVID-19 is in a school. It also goes over what information the health department will ask for when they speak with your school, next steps for the school to take, and a list of resources. The final document is the COVID-19 Quick Reference for Pre-K to 12 Schools. This one-page document provides easy to understand and basic information for schools if someone was in their school while infectious with COVID-19. It goes over how your school will know if someone was in your school while they were infectious and actions to take if someone was in your school while infectious. Overall, the primary prevention team, along with many other teams, are continuously working to create new guidance when gaps are identified and update existing guidance to ensure it remains useful for schools.
Hi, my name is Jennifer, and I am a co-lead on the contact tracing team at the Vermont Department of Health. So I'm going to share with you when there is a confirmed case of COVID-19 associated with a K-12 school. Schools may be notified about a confirmed case of COVID-19 by the Vermont Department of Health, or in some cases, the school may be informed by a parent or staff member of a positive test result. Please note that schools will only be informed about an individual with COVID-19 from the Vermont Department of Health if they were in school while infectious. Schools are expected to treat staff and students with respect and confidentiality when there is a confirmed case of COVID-19. If the confirmed case is present at school, the school will be asked to isolate the student until they can be sent home or send home the staff or teacher, Clean and disinfect all high-touch areas potentially used by the person no less than 1 hour after the sick individual has left the room. Increase ventilation in the areas used by the infected person. Close off areas used by an infected person, and do not use these areas until after cleaning and disinfecting occurs, ideally after 24 hours. If the confirmed case is present at school or was present during their infectious period, we will ask the schools to collect information to help build a lined list. A line list is a document that lists all people who had close contact with the person with COVID-19 during their infectious period. This list will be used to assist with contact tracing. A close contact means being within 6 feet of someone for more than 15 minutes while they were infectious. Someone is infectious starting 2 days prior to symptom onset, or for those without symptoms, 2 days before their positive test collection date. Once a line list is created, a school administrator or COVID-19 coordinator should call the Vermont Department of Health. A line list can be built using the following: seating charts, class schedules, bus seating charts, attendance records, activity participation records, or any other records of staff and student movement. Contact tracing will use this list to follow up with exposed individuals, so we ask that the list be as comprehensive and accurate as possible. What is contact tracing? Contact tracing is used to provide education, support, and guidance to people who are diagnosed with an infectious disease. It's also used to identify people who have been in close contact with them so they can take steps to stop the disease from spreading to others. Here's how contact tracing for COVID-19 works in Vermont. If you test positive for COVID-19, you will get a call from the health department. A trained public health worker, called a contact tracer, will give you guidance to stay home and away from other people until you recover. This stops the virus from spreading to other people. They will answer your questions you may have and see if you need help getting resources to stay home. They will ask you questions about your symptoms, activities, and who you may have come into contact with during a specific period of time. This information is only used to prevent the spread of COVID-19. Based on your answers, the contact tracer will help you identify any close contacts. Generally, these are the people with whom you were in 6 feet of for at least 15 minutes during the time you were infectious. Those people may have been exposed to the virus, which means they have a greater chance of getting it themselves and then spreading it to others. If you're identified as a close contact, a contact tracer will call you and tell you the date when you may have been exposed. They will give you guidance to stay home and away from others for a certain amount of time, and they will ask you to watch for symptoms and ask if you need any help while staying home. The contact tracing team will maintain confidentiality when speaking to close contacts of a positive case. The contact tracer will not disclose the name of the positive case to those who are identified as a close contact. A positive case will be asked to isolate. Isolation means the period of time where you will stay home and away from other people until you recover. Isolation starts as soon as you notice symptoms, or if you haven't had symptoms, it starts as soon as you get a positive test result. Those identified as close contacts will be asked to quarantine. This means staying home and away from others for 14 days to stop the virus from spreading to other people. Day 0 is the day you were in close contact with the person who tested positive. The school will be asked to excuse individuals who are isolating or quarantining from in-person learning until they can return to school safely. What happens if the Vermont Department of Health determines that the situation has become an outbreak? The Vermont Department of Health contact tracing team and Operation Prevention and Response team will work together with the school to determine a recommendation for how to proceed. This may involve a partial school closure or a complete school closure. Please note that the Vermont Department of Health defines an outbreak in a school setting as 2 or more laboratory confirmed and epidemiologically linked cases among students or staff within a 14-day period. That means those who do not share a household, do not have a close contact with each other in another setting, and have no other more likely sources of exposure. For example, siblings who live in the same household who test positive are not considered epidemiologically linked cases in a school setting. As you've heard, our primary prevention team has compiled many useful documents and resources for K-12 schools. This resource provides an overview of the Vermont Department of Health's contact tracing process. If you'd like to know more about contact tracing, you can visit our website, healthvermont.gov.
My name is Julia Pringle. I'm an epidemiologist at the health department. And during the COVID response, I've been co-leading one of our teams here that focuses on outbreak prevention and response. So thank you all for joining today. I really appreciate your time and attention. I'm gonna walk through an overview about how our team works with other colleagues at health departments and also schools to respond to cases of COVID-19 in schools. So as my colleagues Jen and Jen mentioned earlier, we have multiple teams here at the health department working to ensure a safe and healthy start to the school year. Like I said, the team I work on is called Outbreak Prevention and Response, or OPR for short. We are a team of public health nurses and epidemiologists with training and experience in infection control and COVID-19 outbreaks. Since the beginning of the pandemic, we've been working with a wide variety of facilities like daycares, businesses, manufacturing facilities, and correctional facilities experiencing cases and outbreaks of COVID-19. We've spent the summer preparing our guidance and protocols to ensure that we are ready to respond to cases and outbreaks in K-12 schools as well. Our team members in the health department are located both at the state health department's central office in Burlington and also across our 12 district health offices that span the state. Many of our team members have already existing close partnerships with schools through their roles as school nurse liaisons and maternal child health coordinators. My colleague Jen explained earlier what happens when the health department learns that someone in Vermont tested positive for SARS-CoV-2. Jen explained how that case identification launches a contact tracing investigation with the goal of identifying close contacts who are at elevated risk of becoming cases themselves. Contact tracing's goals are to provide recommendations to those close contacts to quarantine at home. The team I work on, OPR, gets involved here where I've placed this red box. This is when our colleagues in contact tracing identify that there's a risk to a facility because a positive individual was in the facility during their infectious period. We work closely with the contact tracing team and the facility directors to assess the risk of ongoing transmission and to provide recommendations about how to prevent any further spread. Our response process to cases in schools will be similar. We've developed a protocol that we referred to as our rapid response team, which outlines how we will coordinate with contact tracing and other health department teams, as well as school officials and administrators when we learn of a case in a school. Within 24 hours of learning of a case who attended school while infectious, a rapid response team comprised of our contact tracers and members of the OPR team will initiate a meeting with school officials. We have teams at the health department who work on the weekends and during the evenings, and we also have a 24/7 on-call epidemiologist, so this response will take place even if we learn of the case over the weekend. During the rapid response meeting, OPR and contact tracing will jointly assess the risk to the school of ongoing transmission. We will also provide guidance and answer questions around infection control, personal protective equipment, cleaning, and disinfection. We can help schools assess whether there is a need for broader testing, and in some outbreak settings, when testing resources surpass local availability, we can help facilitate backup support. Finally, we can help schools identify any additional mitigation steps that they can take to reduce the likelihood of further spread. In Vermont, contact tracing has been timely and effective. It is our best tool to fully understand the risk of transmission to a school, and we will base our recommendations to schools and communities off the findings from the contact trace investigation and the information gathered during the rapid response team call. Since all situations are unique, there isn't a one-size-fits-all recommendation. Instead, we will use the epidemiologic information we gather to provide the best guidance we can, tailored specifically to the situation. All right. Ultimately, we see our role, along with our contact tracing colleagues, as helping schools identify and exclude high-risk close contacts, thereby limiting the spread of SARS-CoV-2. It's a school's decision, not a health department requirement, if they choose to switch to remote learning temporarily after a case is identified at school. We can help schools assess the risk to the school and answer questions they have about the decision-making process. I hope our teams have helped shed some light today on how we will respond to COVID-19 cases in schools. For those of you interested in a more in-depth understanding, we will be posting an interactive recorded tabletop exercise on our website in the coming days. The exercise is intended for schools who will be instructed to use attendance records, seating charts, and other information to practice what a response to COVID-19 would look like for them. The tabletop will be publicly available and provide a very detailed picture of what resources schools might use to respond appropriately. I encourage anyone interested to keep an eye out for this resource coming soon on our website. Finally, our teams are planning to attend the Vermont School Board Association's live Q&A on October 1st. We'd be glad to address any additional questions you have at that time. Thanks for your time and attention today and for all the partnership and support. We appreciate all the hard work and effort that has gone into ensuring a safe and healthy start for Vermont schools. Thanks.